2 million Palestinians in Gaza are living in an ever-shrinking crowded space while Israel controls around 60% of Gaza's original territory of 365 square kilometers. Forced to live in tents amid the rubble in unsanitary conditions with summer temperatures rising, the majority of people suffer from acute diarrhea and skin conditions. Israeli restrictions on the entry of generators and engine oil are driving widespread system failures, reducing health and sanitation services, debris removal and the movement of humanitarian teams. Israel is continuing to block supplies of medicine, diagnostics and screening tools, including insulin, syringes, blood pressure devices and cardiovascular medicines. The healthcare system in Gaza is broken. Only 43% of all facilities are operational, but only partially, with just 23 centers fully functional across the Strip. Well, the International Red Cross Field Hospital in Rafah is one of very few functioning health facilities in southern Gaza, serving as a primary healthcare provider in the area. Recently, it saw the entry of medical equipment crucial to respond to the medical needs of people in Gaza, but the organization warns that a single field hospital cannot cope with the sheer scale of what is needed. I spoke earlier to Pat Griffiths, who's a spokesperson for the International Committee of the Red Cross. He is in Rafah and talks about the pressure to meet the health needs of Palestinians and how Israeli attacks impede those efforts.
At the Red Cross Field Hospital here in Rafah, we aim to provide a holistic health response. So it runs the full gamut of what you'd expect from a hospital to provide. So we have in and outpatient departments, an emergency department, maternity and pediatric wards, a blood bank and a blood lab, and also physiotherapy and psychosocial support services. But at the end of the day, no, this single facility cannot meet the health needs of the area. It really requires a collective effort. And this is, I think, the fundamentally frustrating thing about humanitarian work, is that the humanitarian needs always outstrip our ability to meet them. And that's why our field hospital is just one part of a broader network of health facilities across Gaza, which are under immense pressure and which have all in some way been affected by the armed conflict. I've seen hospitals in the last week here that don't look as hospitals should, riddled with bullets or damaged by explosive blasts. From colleagues here, I hear stories of paramedics, nurses and doctors who have been injured or killed in their line of work just trying to help others. That's not the picture that we should see in terms of healthcare. Under international humanitarian law, healthcare itself is protected. What we see here is healthcare as a casualty of the armed conflict.